And another big story we're following at 11 o'clock, another virus that we've been talking about that is not COVID, monkeypox. So there are more than 250 confirmed cases throughout the world in the past 2 weeks alone. 10 of those in the U.S., some of those actually in Virginia. Now, the CDC expects those numbers to rise even more and recommending that the most at risk now get vaccinated. So we wanted to find out more about it. And should you be worried or not? WJZ Live at 11 o'clock. Annie Rose Ramos took your questions straight to the experts. Annie Rose.
Well, Rick, there are so many questions surrounding monkeypox. What is it? How do you get it? Who's most vulnerable to it? And that is why, as you mentioned, we took those questions to a local expert here with Johns Hopkins. He has everything you need to know in 90 seconds. Do the masses understand monkeypox?
Not necessarily.
I guess the name of it.
I don't really know much about it.
WJZ taking your questions to a local expert. What is monkeypox?
A viral disease that's been known to science since the 1950s. It's from the same family of viruses that includes smallpox, and it's characterized by a rash, fever, swelling of the lymph nodes, and has been something that's been spreading for some time in about a dozen African countries. And it's considered to be endemic in those African countries, not usually seen outside of Africa.
What are the symptoms?
Fever, flu-like symptoms, and then a characteristic rash, as well as lymph node swelling. And that rash can be on your arms, it can be on your legs. And in this outbreak, we're particularly seeing rashes or skin lesions in the genital area.
How do you best avoid getting the monkeypox?
It's spreading from close person-to-person contact, specifically in sexual networks of men who have sex with men. So it's very important that you practice safe sex, that you're aware that this is circulating in those networks.
Is this something that people should be fearful of?
Monkeypox is not a very contagious disease, and we should expect to see more cases in different parts of the United States because it is spreading amongst social networks, but it's not spreading through casual contact. It's something that requires close, prolonged contact. So this isn't something that should alarm the general public.
Now, Vic, another important note. On Monday, the World Health Organization said they do not believe this monkeypox outbreak will turn into another global pandemic. Reporting live, I'm Annie Rose Ramos for WJZ.